Hi everyone, this is a quick lecture on pediatric wellness. I hope by now you've had a chance to go through the adult and the geriatric wellness modules. I hope that as you've been listening to the lectures and you've been looking through the content within those modules, you've noticed a pattern. A lot of the visits that are considered a wellness visit, whether they be for a child, an adult, or a geriatric patient, all of them have certain components, and they're very similar throughout. So as you're going through this module, one of the biggest things that I can tell you to do is that you utilize the resources like your CDC immunization schedule, your Denver developmental schedule. All of those things are going to be very helpful for you because even though children will come in at different intervals, as long as you know what intervals those children come in at, and then you work towards memorizing the immunization schedule and the developmental schedule, you'll be able to know what needs to be done and what you need to assess for at each of those visits. When you first see a child for a pediatric wellness visit, there are objectives that need to be met at each visit. Those typically are disease detection, disease prevention, health promotion, and anticipatory guidance. So if you keep those in the back of your mind, no matter what visit you're seeing a child at, whether it be their 6-month checkup or their 16-year-old checkup, these should be the objectives in the back of your mind that you're trying to meet at each of those visits. So the difference between a sick visit and a health supervision visit or a health wellness visit is that instead of trying to fix a particular illness or chief complaint, we basically want to focus on the child's overall health, and not just their overall health, but what is the perception of health from the parent and from the child. So all people in all cultures make decisions that they believe will positively affect their health and well-being. And I'm sure you can think of, different health decisions that you have made throughout your life that have affected your health and overall well-being. So our job as a primary care provider is to assist families to choose lifestyles that will maximize their health using the best evidence available. And this is where that evidence-based practice comes into play. So by exploring a family's health perceptions, you can begin to see reasons behind family health decisions. And this is really important when you have a patient that, perhaps you have talked with them until you are blue in the face explaining a certain treatment plan, but they just keep coming back not following the directions that you gave them. This should be an indication, this should be a red flag to you that maybe some further education needs to be done. But not just that, maybe we need to ask some questions about what their health perception is and if they understand how their actions affect their health. So there are two components of health perception. These include how individuals perceive and feel about their general state of health, and then two, the belief that there is a relationship between health status and health practices. So if you look at the notes section for this particular slide, and I will post the slides as well, there are 11 functional health patterns that the author Gordon in 2010 described. And he uses these to help guide providers so that when they are doing a health wellness visit, these are health-related behaviors that people can engage in. So it's important for us as providers to know that these are things that we need to address. So like I said, in the notes section, I have those listed for you. Some of the ones, and they may sound very familiar to you as well, and then some of them, maybe you didn't think of. So things like nutrition or elimination patterns, activity, exercise patterns, those are all things that we should hopefully be really familiar with because health assessment, we hit those pretty hard. Some of the other ones, though, that you maybe didn't think of that need to be addressed fully in a health wellness visit, even for a child. So when you're seeing a child, you're more so going to be addressing this information with their parents and their perception of their child's health. As the child gets older, then it's important to involve the child and start assessing their own health perception. So things like the role relationship pattern that describes patterns of roles and responsibilities of the patient, and then patterns of relationships with other family and friends. So this is important, especially once kids grow up and they get into their teenage years. With just the hormones, and also just this day and age, it is tough to be a teenager. So it's important to understand and to make sure that the teenagers that you are seeing in a health wellness visit have healthy relationships, because this really does play a role in their overall health. And then values and beliefs patterns. These describe patterns of values and beliefs that influence daily living activities. They guide decision making and provide meaning to life. So these are just important as well, because as children continue to get older, their values and beliefs are going to change. A lot of the times we'll see that children hang on to whatever values and beliefs their parents taught them, but once they get into those teenage years and beyond, that's when they start to develop their own. So even though a lot of the times we think of providers with a focus on just physical health, we also, a good provider at least, to give that holistic care, we cover not just the physical health, but the mental and the emotional health of our patients as well. So important timing to note is the ages for the well child visits are typically birth, 3 to 5 days after birth, 1 month, 2 month, 4 month, 6 month, 9 month, 12 month, 15 month, 18 month, 24 months, and then it'll be yearly after that. Okay. So another important piece to the health wellness visit for a pediatric patient, and this can span across to the adults and the geriatric patients as well, but we want to support the families, but especially for pediatric patients, because in those beginning years, the children are not they are not their own primary caregiver. It's the families, and especially if it's a new family, so a new mom and dad, they're going to have lots of questions and they're going to look to you for the answers. So understanding and building on the strengths of the families requires healthcare professionals to combine well-honed clinical interview skills with a willingness to learn from families. What that means is that the interview portion of our exam is the most important a lot of the times for these visits, because it's our responsibility to determine where a family's strength lies, so that we can encourage them and tell them that they're doing those things correctly. And then if there's a weakness, or maybe an area where the family has some more questions or they're unsure about, that's where we can kind of focus our time and really educate our patients and develop that healthy patient and provider relationship, so that they feel comfortable asking us those questions. So some good things to know also down in your notes section, some determinants of health for children, and these are important to know. So these are also things that you're going to want to address in your interview with the patient and the family, and then also in your charting. So determinants of health for children include the family, healthcare literacy, community involvement with health of children, the environment, peers, and then culture. So going back to our discussion about teenagers, peers, if they're hanging out with peers that typically get in trouble a lot. So maybe they've been in trouble with the law multiple times. They've been caught with drugs at school. Research has shown that those teenagers are more likely to not be as involved in their health care, and to later on, and even during that time, have more healthcare problems that you will have to deal with. If you look at the family, if you have a family that's not very supportive, and perhaps, if maybe sometimes you even question if there is a little bit of neglect going on, that of course is going to affect a child's overall health. So clinical findings that indicate a problem with health perception and health management, I really want you to pay attention to this section down in the notes, because these should be red flags. These are things that, as you are observing the parents with the child, these are things that should maybe stick out to you, so that you know that perhaps you need to investigate a little bit further, or offer some more support, or maybe provide some patient education. So they really should stand out to you. So 1, there's no regular healthcare provider for the child, or 2, history of lack of continuity or fragmented care. 3 use of emergency department for non-emergent conditions. And this happens a lot, especially where I work at in Marion. There's really there's a lot of there's a big issue with health literacy, basically. And so a lot of parents will, not understanding that the ER really is for just more emergent needs, they'll bring their children for a little rash, or maybe just a cough. It doesn't necessarily look infectious, but it's just a cough. So instead of going to their primary care, they probably a lot of the times don't have a primary care provider, and they just use the ER to go and to seek care. So lack of follow-up care for the child seen in the ER, failure to adhere to prescribed medical treatment or standards for well child health supervision after having adequate information provided. That's a big one. Child at risk for delayed or ineffective treatment, or both. Poor health status of a child as a result of untreated illness or other health problems. Under immunization, so this tends to be a big one as well. And sometimes I feel like a lot of the times this goes along with they just haven't had a provider that has taken the time to sit down and talk to them about what each of these diseases can cause and why it's important to get the vaccination, and also how each vaccination works. A lot of people are afraid that we're poisoning their children, or, we're going to make them sick with this disease. And a lot of that stems because they just don't understand. 9, barriers to healthcare services, knowledge deficit about children, knowledge deficit related to illness, parents' dissatisfaction with healthcare providers, and then risk-taking behaviors. And a lot of the times, especially when the children are younger, that goes along with the parents. So, this may be they really just don't feel the need to put their child in a seatbelt or a car seat. So these are things that would be considered a risk-taking behavior, and they need to be addressed. I also, in the notes section, I won't read through them because I know I read through that section for you, but I really felt like that was important. But I did include some management strategies for dealing with those health patterns. And one thing that I feel like I was really blessed with in my career was my time in palliative care, because in schools, in nursing schools and medical schools, PA schools, I feel like we do a poor job of teaching providers how to communicate with their patients, because it really is an art. And so I included some strategies on how to deal with these patients and how to possibly deal with the ones that maybe are a little bit more resistant to your care. For me, those are usually the patients that I enjoy, because it creates a little bit of a challenge, and you'll find those, especially in some of the bigger cities. I know I ran into many of them when I was working in Chicago. So developing some strategies now on how to talk with those patients. And I will tell you, a lot of the times when you're talking to a parent that is possibly just hasn't had the best life, maybe they have a low income or really just no income. They don't have a lot of resources at their disposal. Maybe they don't have a supportive family. Being blunt with them and kind of telling them what to do a lot of the times doesn't always work. Sometimes you have to get down on their level and say, how can I help you? These are the resources that I have at my disposal. I want to help you. So, you tell me what do you need? How can I help you? And a lot of the times those parents are just waiting for somebody to say that, and they appreciate it later on. Okay. One of the other important things in these health wellness visits that I feel is very important for the pediatric visits, especially, is to help families develop sound decision-making skills. I'm sure if any of you guys have kids out there, I know a lot of you do, and you guys know that I have kids too. I will tell you, when my kids have been sick, I pride myself at the hospital for being able to handle stressful situations really well, because I typically am able to stay very calm. But when it comes to my children, and I'm sure some of you have been through the same thing, when your child is sick, it is a whole different ball game. So teaching families how to develop sound decision-making skills when it comes to an illness is very important. And that way they understand that you are there as their support person. So you are the person that they can come to and ask questions, and you with them will develop a plan together, and you guys will deal with this problem. Okay, so teaching them to identify the problem and then also generate some alternative solutions together, and then you evaluate those alternatives. So looking for cost effectiveness, feasibility. So all of these things you discuss with these parents. So if you have a child that possibly is dealing with some issues of constipation, and you'll find that that is very common in children, and it's very stressful for parents. Working together, coming up with some solutions, and then also if this solution doesn't work, letting them know that there's some alternatives so that they can have that peace of mind. And then also letting them know that this is something that you'll review at each health wellness visit. You'll discuss it and, see what worked, what didn't work, and then come up with a follow-up plan. These are some important definitions revolving around the health wellness visit. So the disease prevention, the health promotion, the anticipatory guidance, that is one of the most important ones, because at each visit you should be giving parents anticipatory guidance. And basically you're anticipating emerging issues. So you're answering their questions and concerns before it happens. So for example, if a patient or if a parent wants to know or is asking about, well, when will my kids start developing teeth? Well, you can say they should start developing their teeth around 3 to 4 months. The majority of their teeth should be in by 12 months. 12 to 13, 14 months, they should have the majority of their teeth. Or they might say, when will my child start walking? And you'll say, well, on average, most children start walking around anywhere between 10 to 14 months of age. So just giving that anticipatory guidance. It needs to be timely, so it needs to be delivered at the right age. So you don't want to give them information too soon, but you do want to give it before they can expect it to occur. You want it to be appropriate, so for that specific family. So if you have a family that is that's breastfeeding, if they're not using formula and they're doing great with breastfeeding, there's really no reason to give them further patient education on formula unless they need that, and encourage them and support them in their breastfeeding and offer them guidance as needed with that. You want to make sure it's relevant, so again, pertains to that child, family. And then again, this is an opportunity to broach important safety topics. So you want to help the family address relationship issues, access to community services, and you want to engage with the family, the schools, the neighborhood, and faith communities. This is all important pieces to the health wellness visit. So as you are looking through this module and looking at some of the content that I added in there, these are the components of a pediatric wellness visit. So you always want to set priorities. The very first priority should be answering any questions that the parent may have, because if you start that out right at front. So if you think of your SOAP note, at the beginning we have that chief complaint. Even though this may be a health wellness visit, it's a scheduled health wellness visit, they may be having some issues or have a question. So asking that up front, and then that way it allows you to deal with that throughout the visit while you're also doing everything else you need to do for that health wellness visit. It'll be very helpful for you. I mean, like I said, constipation is a very common chief complaint in younger children, and there was many times that it wasn't, both of my kids dealt with constipation really bad, and it wasn't bad enough that I had to necessarily schedule another appointment, but when my health wellness visit for them came up, that was something that I asked about. I asked my pediatrician, do you have any other suggestions? This is what I've tried. So just keep that in mind. Make that your first priority. And then, of course, we're going to get a subjective history on the child, and we want to focus on their growth, the nutrition, elimination. So go back to that first slide, some of those health patterns that we need to address, sleep, nutrition, all of those things, development, all of those things that, that are important to a person's overall health we need to address. So again, gathering that patient history, you want to watch the development of the child. do a thorough review of systems, observation of the parent-child interaction. This is important because this will give you a lot of information. I remember when I first started working in the ICU, I had a really good mentor in the ICU, this old ICU nurse that had been working in there for years. And she said, you should get the majority of your assessment from walking into a room and just looking around and see how that patient looks, what are they hooked up to, what IVs are running, who's present in the room. And it's the same thing when you talk about a pediatric visit. Who is present in that visit? Is it just a mom? Is it a mom and 5 other children? Is it a mom, a dad, a grandma, a grandpa? So they have all this support. Those things are important to know. Does the child seem to be comforted by the parent? If they say they stumble on the ground, do they seek their parent for comfort, or does the parent seem really anxious when dealing with the child? Do they seem like they're not quite sure what to do? So all of these things can be observed from you. Physical examination, of course, you're going to do a full head to toe for this child. In every visit, you're going to include weight, height, head circumference. And I will tell you that it's important as you are studying to make sure that you know the averages of those for each visit. And then certain screenings, I also provided some tools in the module on scheduled screenings and when they should occur. At the beginning, when a baby, when you're dealing with a baby, a lot of the times there's not a ton of screenings, except for you're going to look at their hearing, and then blood work if you think that there might be a possibility for anemia. Those are the two big ones. Immunizations, of course, and like I said, the best thing to do is to follow with the CDC and what their recommendations are. It doesn't typically change. It's been, for the most part, it'll stay the same. Sometimes they'll make little changes here and there, but just always keep an updated version of that. And then again, that anticipatory guidance. If you guys look in the notes section, I have further detail about each of those. So if you want to look through that, on average, a provider should take anywhere between 20 to 45, maybe even 60 minutes for a pediatric wellness visit. Typically, I think for the docs, they schedule about 30 minutes. A lot of my friends that are pediatric nurse practitioners, I think a lot of the times they get like 30 to 45 minutes. And just know, sometimes they take longer. Sometimes, if you have a family that's not as talkative, it may take less. So it just depends. It varies patient to patient, but that's about the average. So I want to finish with this slide. So these are just some important pieces to know. Like I said, a lot of the pediatric wellness stuff is really just you memorizing. So you need to memorize when the immunization should occur, at what ages and what it spans over. You need to memorize what the average weight, height, and head circumference is for each wellness visit for a child. You need to also memorize the developmental tools, and I have all of those down in the notes section here. So you can use the pediatric health promotion grid, and that'll help you know the developmental milestones a child should hit at each visit. Again, the CDC for vaccination schedule. They also do have they have the full immunization schedule, and then they have the one where you can kind of lengthen it out for families that are concerned about their child getting too many shots at once. They do have a couple of those different schedules that they can follow. Also, the 2018 recommendations for pediatric screening and preventative healthcare table. That is a good one to do. Remember that with any immunization, and this could be on your boards as well, when you are doing an immunization, the documentation must include the date of administration, name or common abbreviation of the vaccine, the lot number, the manufacturer, the administration site, the vaccine's information statement edition date, and then the name and address of the vaccine administrator. Also, make sure that, especially as you are seeing young adults, you want to refer to Tanner stages. So, I think that it would be great if you could just, there's a lot of scales that you can just print off on that, and then that way you'll have the Tanner stages with you so that you can document their sexual development appropriately. And then each visit, like I said, you'll need to do a full physical examination. So know what is normal, and then know the urgent abnormals. So it's, if you try to memorize all of the abnormals that there could possibly be, you're going to be overwhelmed. So the best thing you can do is know what is normal. And then know what is urgent abnormals. So if you have an urgent abnormal, that is something that you should not miss. It's called a no miss on the board's examination. So there, certain questions with that. And then you want to know, those are typically the ones that you refer out. So different things that you need to refer out for. You also always want to assess for social, family, health risk factors, family interaction, any evidence of abuse. That's an important one. And then when you're discussing anticipatory guidance, you want to discuss feeding, sleeping, pet, home safety, car safety, health food choices, choking prevention, future development. All of those are important topics that a lot of families want you to discuss with them. I'm going to include, I figured instead of going by visit, because a lot of it is the same. Like I said, it's just really things that you need to memorize. I'm going to have another PowerPoint presentation that I will develop that'll have case studies. And so we can talk about each of those cases through that case study. And then again, if you guys have any questions, you feel free to email me. Okay. And then look through the module, print off some of those screening tools and the scales that I put in there. And again, like I said, let me know if you have any questions.